Hi, my name is Gregory Chase.
And I am Lori Franklin Williams.
We are coming to you from the Bureau of Clinical Resources and Services. Our Bureau is tasked with the level of care rate determinations and redeterminations. We speak for the rest of the department in wanting to be very intentional, transparent, and deliberate in our communications about this rate determination protocol.
The objectives of this presentation are to 1. Inform you of the full implementation of the level of care protocol. 2. Educate you about the process of rate determinations and redeterminations using the level of care protocol. 3. Discuss how the department will be communicating with families about rate determinations and redeterminations. And 4, provide a mechanism for you to submit general questions about LOC and to also direct you to the right parties to answer specific questions regarding LOC in your case. In March of 2021, the state announced full implementation of the level of care protocol for all approved resource families in home-based family care settings. The LOC rate determination protocol has been implemented for new entries into foster family agencies since March of 2018. So while this process is not new to the department, per state guidance, it is being expanded to include all resource families, not just FFAs. The level of rate structure will apply to approved resource family homes, approved relative caregiver homes, non-relative extended family members, licensed foster family homes, non-minor dependents residing in home-based family care settings, kin gap and non-related legal guardianships established through juvenile court on or after January 1st, 2017. This rate structure will not apply to supervised independent living placements, also known as SILPs, short-term residential therapeutic treatment programs, also known as STRTPs, non-related legal guardians established in probate court. The level of rate determination protocol takes into account the resource parent's care and supervision responsibilities across the following domains: physical, behavioral and emotional, educational, health, permanency, family services. Within each of the domains, there is a description of responsibilities with an associated point value. Total points across all domains are tallied to determine the level of care rate. A separate assessment will also assess need for specialized care increment, or SCI. SCI is intended to compensate families who take care of children with extraordinary needs across any or all of the domains. If, based on the LOC assessment, the care of the child warrants a specialized care increment, a new 3-tiered SCI rate structure has been developed to replace the existing D and F rate protocols. This new rate structure aligns with the criteria and payments currently provided under the D and F rate guidelines. In addition to the standard RFA training, SCI certified resource parents are required to take an additional 16 hours of SCI training, which consists of 12 hours of initial foundational training, plus 4 hours of specialized courses. 6 hours of annual renewal training will be due each year. Starting on July 1st, 2021, for those who are already receiving the F or D rate, you will be required to take the new SCI training when your child's annual F or D rate assessment is due. Training is free, and training sites with the Foster Kinship Care Education and fosterparentcollege.com will be listed following the presentation. The department's SCI methodologies have been developed under the Continuing Care Reform, also known as CCR framework. and therefore there is a clear expectation that services are developed through a single assessment process, which will capture the shared view of the family's strengths and needs, as well as a shared planning process. Additionally, in acting within the CCR philosophy, the SCI methodologies represent a coordinated, integrated assessment process with the goal of increasing access to specialty expertise and resources. And now we can talk about the information gathering process.
The level of care determinations are made through a centralized level of care unit to support the regional office and also to ensure objectivity and consistency throughout the department. The level of care unit gathers information from various sources to complete the LOC matrix. Sources include case carrying CSWs, caregivers, mental health providers, public health nurses, court reports, CANs, screening assessments, child and family team meeting notes, among others. The level of care, level 2 through 4, may only be paid retroactively to April the 1st, 2021 for non-FFA resource family approved caregivers. If the circumstances or the needs of the child change and the CSW submits a redetermination request, the new level of care rate is effective the date that the redetermination request was requested. The level of care rates are as follows. Level of care 1 is $1,037. Level of care 2 is $1,153. Level of care 3 is $1,271. And level of care 4 is $1,378. We will notify families through a notice of action explaining your rate that has been established. When the level of care is completed, caregivers will receive a copy of the completed level of care protocol matrix, including the boxes checked next to the description which applies to the resource parents and the child. You will also receive the level of care scoring sheet and the completed resource parent tool. If there are specific questions related to level of care and your case, you are encouraged to ask your case carrying CSW. For general questions about level of care, please email askloc@dcfs.lacounty.gov. That is askloc@dcfs.lacounty.gov. Now here is the director of our bureau, Dr. Stacy Barron.
Hi, I am Dr. Stacy Barron, and I am the Director of the Bureau of Clinical Resources and Services. As a department, we very much appreciate your dedication to the health, wellness, and safety of our children. We want to make sure you are equipped to meet the needs of the children in your care, and we want you to reach out with any questions or concerns that you may have. Thank you so much for your attention today. At this time, I'm going to field questions to Gregory and Lori that we know you may have regarding LOC. Lori, will resource parents who are trained medical professionals be required to take SCI training when their annual assessments are due?
Yes, all resource parents will be required to attend the new specialized care increment training, as it is a new curriculum and encompasses more than just medical knowledge.
And Gregory, will medical forms 149A and 561A be required for the specialized care increment assessments?
Yes, the 149A and the 561A forms will continue to be required for the specialized care increment rate.
And Lori, how often is a level of care rate determination done?
An LOC assessment is completed within 60 days of the child or youth's first day of placement or replacement. There's no annual LOC rate determination requirement. The rate in your home remains the same. However, if a child or youth's care and supervision needs change, you can have a discussion with your placed child's team and ask the primary social worker to submit a request for an LOC redetermination.
And Gregory, a level of care redetermination happens at each placement change. Does the rate change each time?
Yes, it may, or it may not. Every placement is unique and receives a new and complete level of care determination, as each resource parent may provide the child or the youth with different types of care and supervision. For example, the family may participate in different visitation schedules, different activities, different sports, homework assistance, community involvement, cultural events, and spiritual participation that is child focused. So it may or it may not.
And Lori, how many youth with specialized care increment can be placed in a single household?
2 special rate children or youth can be placed in a household unless a regional administrator has approved the request. For example, a sibling set may have more than 2 special needs children in it, and the resource parent is specifically trained to meet those needs or has assistance in caring for the special needs of the children. This approval process is done through the primary CSW and their chain of command.
Thank you so much, Greg and Lori, for answering these questions. We know that you may have additional questions about the level of care implementation. For general questions, again, please feel free to email askloc@dcfs.lacounty.gov. Thank you so much for your attention to this video.